study that showed, after there was a study that showed that South Carolina was leaving millions of federal dollars on the table, but there was still a great need in the community. So we started with application assistance after that to make sure that we are indeed trying to get the resources out to the individuals and families that needed it. So that's how SE Thrive came about, because we didn't want to lose that federal funding when there is still a great need in our community. So looking at this slide, we were talking about self-sufficiency. So did you know that in Charleston County, the self-sufficiency standard is $18.81 per hour of a wage in order to sustain a household for the size of like 2 adults and 2 children. So definitely we know that most individuals that we serve are not making that money, but as you can see to the map, Charleston County has one of the higher standards in South Carolina. So there's definitely a need in order to get these services to individuals and their families. So we partner with different community agencies in the area to try to make sure that we are servicing the community. And so some of the things that we do is connecting those families and individuals to resources, and we host trainings. But one of the important pieces, we provide technology. So technology to make it easier and try to eliminate some of the barriers that people face when they need application assistance. We have a way of trying to connect the whole individual. So we try to take a holistic approach to connecting people to resources. So we look at the physical, the mental, financial, and much, much more. So we are definitely trying to solve that, look at the whole well-being of the individual to make sure that those resources are available to them for sustainability. And how do we do that? This list here is about some of the physical resources that we have available that we try to connect individuals to. We mentioned SNAP, which used to be called food stamps, but now is Supplemental Nutrition Assistance Program. There's the Medicaid program, and then there's Prime. Prime is a more advanced healthcare coverage for seniors who are dual eligible. So they're getting Medicaid and Medicare. Then there's long-term care and Well Vista, which is a program for the uninsured individuals. So they don't have any type of insurance and it helps them with prescriptions. Then there's family planning. And right now there's also the Medicare Savings Plan, which helps individuals with their Medicare premium so they can get more money in their paycheck and their check from Social Security if they are age blind or disabled. So these are some of the resources that we do to help people access healthy foods and also medical and healthcare coverage. And so long-term care is one of the part for the elderly individuals and our seniors. And right now, one of our partners, Trident Area Aging, are authorized we train them in order to take those long-term care applications for seniors in the community. So they don't physically have to go to the site. They can call Trident Area Aging. They can call our contact center, which I'll share that information with you later on, in order to access these applications. So SNAP, this statistic says over 555,000 people in South Carolina face food insecurity. So then that is important. And one of the things that we take applications for, it is one of our top applications is for the SNAP program when we're connecting families to resources. So additional SNAP benefits are healthy bucks, medical deductions, and their senior farmers market for nutrition and Project Hope. So SNAP help people to purchase healthy food, and it's loaded onto their EBT card monthly and is accepted almost anywhere. So usually there's a sign on the door that lets you know that this person is a SNAP provider. And the Healthy Bucks program is a program that helps you stretch your SNAP dollars a little further. So SNAP recipients who purchase at least $5 with their SNAP EBT card at participating locations receive $10 in Healthy Bucks tokens to purchase additional fresh food and vegetables. So one of the important things is getting the word out about this program. And one of the things that I can do at SE Thrive, if you're listening and you want to be one of our partners, we definitely have marketing materials that we can provide to you in order to make sure that people are aware that there are all these different resources in the community. And SNAP is one of the #1 application assistance that individuals and families have applied for. Now, healthcare coverage is dear and near to my heart because, like I said, I was at the Medicaid office as the long-term care coordinator. So, and what I saw there were people who needed the service, but they didn't know how to apply or how to get through the application process. And one of the things that we do here at SE Thrive is we are able to take these applications for Medicaid, SNAP, Well Vista, all at the same time using one application. So we will even help you over the phone to complete these applications. SE Thrive is the only organization authorized to accept electronic signatures, telephonic signatures through the phone for DHHS and DSS. So that's one of the things that we are proud of, that we have partnered with these government agencies in order to make the application process much easier. So Healthy Connections Medicaid provides health care coverage to individuals and families with low income. Family planning, that program helps you with biannual checks. So for example, physical checkups. For example, you might go to a fair and they tell you that you looks like you have a diabetes diagnosis. So these kinds of things, Healthy Family Planning will pay for the initial checkup, but you will definitely need to follow up with more healthcare coverage in order to get that diagnosis taken care of and make sure that you're on the right medication. But family planning will allow you to do an initial physical checkup. Also, it also helps with family planning, things such as birth control, vasectomies. Family planning also has that benefit. Then there's the medically needy indigent assistance program. So those are for individuals who are in the hospital and they don't have any other healthcare coverage. And it's called MAIP is the short term for that particular program. But a lot of the hospitals will refer individuals to this program when they have been admitted and they don't have any other health coverage. Then there's the Medicare Savings Plan and Extra Help. So these are programs that, depending on your income, if you're receiving Medicare, if you're eligible, then Medicaid will pay for your Medicare premium. So a lot of people are then going to be saving $150 a month. And that is significant when you're on a fixed income. That can make the difference between, having meals or having your light on. So a lot of people are not aware of this program, but there are programs, they're called SLIM, the ABD program. If you're eligible for those programs, the Medicaid program will pay your Medicare premium. And then there's Well Vista. Well Vista is for the uninsured, again, without any healthcare coverage at all, and it will help with prescriptions. And on this slide, I put our contact center telephone number, which is 1-800-726-8774. And they are open Monday through Friday from 8 to 5 to assist anyone who wants to apply for any of these programs. Paul, do I have any questions yet?
No, Janise, there aren't any questions just yet. How about anybody on the panel? Anybody got anything?
That's some very good information. I'm just making a comment that you're passing out. Don't have any questions right at the moment, but very good information.
Thank you. And recently, SC Thrive acquired the Help Me Grow centralized point of access for this particular program. This particular program helps individuals who have kids between 0 and 5. So it helps with developmental delays. So it says that 12.6 of children in South Carolina have some type of developmental delay. And so we are now the centralized access point. So we have 2 care coordinators that are located in Columbia, and they will answer families' questions in regards to what's the next step? What do I do? How do I get evaluated? So again, they are in Columbia, and if you call that number, 1-800-726-8774, they will be able to assist you in getting resources to these children who are 0 to 5. And you know, the earliest that you can catch these developmental delay, the better success you have with your children. So they joined us about 4 months ago. So, and like I said, we have 2 care coordinators who man the line and help families get the resources that they need.
One question I would have for you is, have you seen an increase, since autism and things, along that line there's more awareness of autism, better diagnosis on autism. Have you seen that percentage increase as we're seeing advances in identifying these different things that could fall into the developmental delay?
Yeah, I think a lot of times too, the families, some people think that they're associated with shame. And so it's nothing to be ashamed of. And we're trying to get the word out, and we're trying to make sure that they understand that this is something that does happen. And we have seen more and more individuals calling in and trying to make sure that they connect those resources. We have a lot of partners who also gets referrals from MUSC. And so these 2 coordinators are definitely busy. And I don't know the exact percentage, but they just updated this percentage for us in July.
Okay, fantastic. Thank you. All right, got a couple of questions here for you. The first one is, do you help people sign up for Obamacare if they don't qualify for Medicaid?
Now we don't do the Obamacare. We would just refer you to the link in order to get that assistance. Okay,
gotcha. Mm-hmm. All right. And do you help families figure out the PEBT if they never received it for their child yet? The question is P as in Paul, EBT. I don't know what that is. PEBT.
Yeah. I'm not familiar with the term.
All right, let's see. Pandemic. Okay, pandemic EBT. There we go.
Okay, so the pandemic EBT, EBT, is she talking about the food stamps?
SNAP. Yes.
Yes. So we will take those applications as well.
Okay.
And what happens is we will take those applications and they're automatically sent to Department of Social Services, and then they will contact you with anything that you may be missing. So we usually try to go over everything that you need for that application process, and we will even fill out the forms with you, and then it's automatically sent to Department of Social Services, and then they follow up with you by phone and then in writing if there's anything else that you need.
Okay, fantastic. Now, and one question just came to my mind since we're talking about Medicaid is, are you able to help families? I'm sure you've heard the term stuck in the middle, where you've got a family that's got they overqualify for Medicaid, but the cost of insurance is just too much. Now, I know we do have healthcare.gov as a resource, but what do you do for folks that you find that they overqualify for?
Yeah, so one of
Medicaid?
one of the things that we have available to us is the resource directory. So we try to refer families to different agencies that might be able to fill in the gap when there's a situation where they can't be covered by Medicaid.
Okay. And it looks like we've got Michelle here saying the schools may help with that as well. So great. It's good to know, because there are a lot of folks out there that are riding with no insurance, and
Right.
something pops up and it's like, now it's one of those things that until you need it, you don't think about it. Then when you need it.
Right. And I always encourage everyone to apply for Medicaid if you're thinking you're eligible, if you're close to the limits, because there are different deductions that they give when they're calculating income. And some people are actually working and they don't know about the working disabled program, that you can work and also possibly get Medicaid. So there's a lot of programs out there that is available for health insurance.
Okay. All right. Another question come in is, how do you help the homeless and displaced population? And I see that question now, but I can't help but think that with the eviction moratorium, they can only keep extending it so far. And I think on the last statistic that was released by the White House was they're expecting somewhere in the January to be 750,000 people homeless because of that.
Right.
What are you looking at for that to help?
So one of the things that we do is we are partners with, like, locally here, 180 Place. And so they use our technology in order to help connect the clients to the different resources and make sure that they apply for everything that they're possibly eligible for. So 180 Place is one of our community partners, and they're definitely using our ThriveHub in order to connect them to those resources. Now, through, like I said, SC Thrive is a statewide organization. So then in other areas, we have programs called Veggie RX, and we work with Food Share as well. And so we try to find ways to address the homeless issue, because we know that there is a definite need. And exactly, sometimes we are connecting you through the Medicaid program, where you can get residential care facilities to accept you. And if you're disabled and meet those criteria, then you can find placement in residential care facilities as well.
Okay. Here's another one for you is, we don't have any on the line right now, but I imagine the recording, we may get another nonprofit may decide, hey, how do I get to be a part of the SC Thrive Hub where we can help our clients? How would that work?
Right. So I will address that later on in some of the slides about how to be a partner. And you can always contact me, which I'll have my direct contact information on the slide. And then I can come out and meet with you and talk to you about ways that we can collaborate and ways that you can use the system. We even teach you how to use the system. So.
Wonderful. Thank you. Okay. I think we're good for now. If you want to keep going.
All right. So we also work with mental resources. So we have mental health first aid, we do self-care trainings, and mental health matters. So mental health first aid is a training that we have where we help you to recognize and respond to people who are in crisis and are experiencing a mental health issue. So this class is sponsored by the National Council of Well-Being. And if you take this class, you're certified for 3 years. And we have a youth and we have an adult class. And so there are 2 different curriculums. Now, these classes are virtual, and they usually run from like 9 to 3 p.m. And also, they also require some pre-work so that you, usually the pre-work doesn't last more than 2 hours. And some of the organizations that have taken this class are law enforcement, schools, and other mental health individuals. And you could be just a regular person like me to take this class, and I'm seeing someone who has a crisis, and it definitely helped me to recognize. I used to also work with a lot of, I worked at a residential care facility that had intellectual and disabled individuals. In this class, I wish I had taken it prior to working there, to definitely help me to find ways to communicate and de-escalate situations. And the good thing about this class is we have a grant from Blue Cross Blue Shield, and they are allowing us to offer this class free through the end of the year. Normally it's a charge of $75, but it is free to anyone and everyone through the end of the year. So that's exciting. And then we have self-care training that we will come out and do for you as well. I'm sorry, I messed up the slides. Go back. Okay, I'm back on the right track. We have self-care training, so it's important to definitely take care of yourself and find some outlet in order to relieve stress. And I was saying that mine is when I get stressed and everything, I just break out the yarn and I start crocheting in order to relieve my stress and just help me relax. So I like to crochet. And then we have Mental Health Matters, and this is actually available on Facebook. And what we do is, like, we interview a mental health professional, and this coming Friday, the topic is bipolar disorder. And so we're hosting that, and we'll have a guest speaker that will talk about bipolar disorder. So these are the things that we have as far as the mental resources. And again, I just explained how the mental health first aid class work, and a lot of the school system are participating in this. So district school nurses said that I work with all age students, and it was important to know that there are real signs to look for that call of health. So she definitely said it helped her. And there's a link right down here that says scthrive.org/mental health, and you can register for those classes. Some of the financial resources that we have is free tax filing. I know we have that in common with Increase in Hope. We also do free tax filing. I started in November, and so that was right as tax season was gearing up. And this past season, due to the pandemic, we were not taking walk-ins, so we did it by appointments, and individuals would be able to call our call center and set up an appointment. And we were available Monday through Saturday, and we partnered with the Charleston County Libraries. And so we had volunteers and myself and other individuals from SC Thrive who were trained, and we did free tax filing assistance. And we help anyone, individual who has an adjusted gross income of $65,000 or less, or a couple whose adjusted gross income is $95,000 or less. So we help those individuals with their tax filing, and so that they don't have to pay those large fees that they see sometimes at different tax services. And then there's the TANF program, which is temporarily assistance for needy families. And that is a program through DSS. And this program will give you a check. And the kids, if they qualify for this program, the kids automatically get Medicaid. So we have the capability to make that application as well. And we do financial health trainings. Recently, we partnered with Truist Bank, and Truist Bank has been putting on webinars, and they last about 30 minutes, and they have various topics. And so they do it usually once a month for us, but they are also willing to work with individuals personally, all free, no cost. And so we are excited about that partnership with Truist Bank. And we also do financial literacy classes as well. And coming soon is a workstation in ThriveHub. And so ThriveHub is that technology that allows individuals to apply for all these different services. But in ThriveHub, we are going to have a workstation which will help you build your resume and also do job searches. One of the partners that we recently partnered with is Trident Tech College. So Trident Tech College is trained, and they are able to work in ThriveHub, and they will be using our workstation. So we're excited about that. And so other things and other resources that we are allowed to help individuals with are birth certificate replacements. We can put that request in for you as long as it's in South Carolina. Voters registration, social security card replacement. And just like I said, we have a resource directory that is updated. And so you can put in your zip code and it'll tell you of other resources that may be available to you. Like we previously mentioned, when somebody falls through the crack, then they're able to go in and research this information and see what other organizations and partners that may be able to help them. And recently we have military and veterans resources. We have 3 people on our staff who are veterans. And so they saw a need because they realized that veterans too have issues, and some of them, you would be surprised, still qualify for some of these resources. And so we have a veterans guide, and we will do peer-to-peer support with veterans, and they're able to talk to someone who's been in their shoes and understand how it is when they come back to civilian life and what kinds of barriers and different problems that they experience. And then we have a link for coronavirus resources as well. So like Paul was asking, how do you connect? So there are different ways to connect and access these resources. So you can go through our website, which is scthrive.org, or you can visit one of our partner sites. So like I was saying, like 180 Place, Trident Area Agent, Trident United Way, they are one of our partners. My location is at the Trident United Way office. You can also sign up for your own ThriveHub account, or you can call 1-800-726-8774, and that's the contact center. So there's different ways to access us if you need to have any of these services. And again, as I mentioned earlier, we do host trainings. And so for the public, this is a list of public trainings that we have. We were so disappointed. We were going to do annual training in person at North Charleston Convention Center. And it's professional development, and anyone was able to apply and register for that. But now we are going completely virtual due to the increase of COVID cases. The best decision was to move it virtual. So that will happen on September 27th and September 28th. So if anyone is still interested in registering for a professional development conference, we still will have it, but it will be virtually. And again, these are financial health topics that we talk about: credit repair, debt recovery, and I mentioned mental health before. One of the things that how I was introduced to SE Thrive was when I attended one of their poverty simulations, and I thought it was great. It really opened my eyes to be in someone's shoes. So I had a scenario where I think I was a child, and my aunt and uncle, and I was living with them, and I only had they only had X amount of dollars to last for the month. And then they started throwing different scenarios at us, and we ran out of money, and it was really eye-opening to be able to participate and see things from that person's perspective. So we do that poverty simulations, but with COVID right now, this one table. And then we also will come out and talk about all the different Medicaid programs and give you more information about the Medicaid programs if you like. And then when you sign up to be a partner, we train you on how to be a benefit counselor. We train you on taxes, and then we also do refresher training. So we train you on how to use ThriveHub and how to use that technology appropriately. So again, ThriveHub is the name of the system that we use, and it is powered by GoodGrid. So GoodGrid is the programmer, and so they developed this system which allows us to be able to access all these different programs and have individuals apply for these benefits just using one single application. And so I had a question for a recent partner who joined, and she said, I was concerned about, sharing information, and we can assure you that the information is secure and confidential. So even the individual who's applying for the services, they have the ability to tell us if they want us to share their information with other agencies. So we definitely, in ThriveHub, we keep that information secure and confidential, and we apply all HIPAA policy and procedures in working with DSS and Department of Health and Human Services. So it's an efficient way to access multiple resources on a single platform. So just like I said, you're able to make one application, and then it's automatically ingested into other agency systems. So you can apply for that SNAP, Medicaid, Well Vista, you can do taxes all through ThriveHub. And so for people who ask why use ThriveHub, well, like we said, the individual who's applying for these services are able to give us permission And everyone could go in who's working with that individual, and they can see exactly what's going on with that individual or family. So it also communicates with everyone. So like the caseworker, who the original social worker can see if that person definitely applied for Medicaid, that they also go and see if they could get that food service. So you can go in ThriveHub and it allows you to do closed loop referrals, and everyone can talk to each other at the same time, instead of sometimes the information gets lost because your system is not integrated with the other organization. And so sometimes everybody does not know who is on first and who is definitely following through with that individual. And so definitely that's one of the things and one of the great benefits of ThriveHub, that you're able to see the course and development and see if that person definitely followed through. We also have the ability with other partners who are using the system, we can give you a return on your investment report to see if it's to show you how many families, and attach a dollar amount to those Medicaid applications, those SNAP applications. So that helps you when you're trying to develop the information to apply for other grants. And ThriveHub has like 4 different features. Community, so the community section just lets you know what's going on in the community. So it'll let you know about job fairs, giveaways, everything, any kind of events that's going on in the community, it can be found usually in that section. Find Good is the section that helps connect you to those resources. And then there's a Learning Nook where you can do online tutorials. You can definitely do online meeting rooms within ThriveHub. And just like I mentioned before, the workstation is being developed. And that's where individuals can do career building and also job searches. And so we're, again, excited about that. And Paul asked earlier, what do you need to do to become a partner? And I said, well, you can contact your regional coordinator. You can host a site visit, so we can come and visit and see how we can coordinate. And then you can complete an agreement, in which we call that an organizational agreement, to make sure that you're meeting our HIPAA compliance and our security requirements as well. And partners are able to attend our trainings, and then you just help your client access different resources as needed. So we're definitely growing across South Carolina, and we're definitely hooking up with different agencies in order to make sure that they are aware. And that's one of the reasons why I really appreciate Increasing Hope inviting me today to talk about all the different resources that we have. And this is some of our impacts since 2010. And so working with different partners throughout the state, we have been able to return over $740 million to South Carolina. And that's definitely, we didn't do it by ourselves. We did it with other organizations and other partners. So we also have served over 387 South Carolinians and completed over 294,000 applications. So that definitely number is increasing as we get more partners involved, and being able to serve South Carolina and making sure that we don't lose any federal dollars in South Carolina, because South Carolina definitely needs as much money as we can get, because we have a high poverty population. And so one of the things that we did last year is somebody was able to give us money, and we were able to do housing assistance. So we are just thankful for all the partners that are able to help us reach these families and individuals. And some of our sponsoring partners, this list is not all inclusive, but it's some of our partners that we work with, Department of Health and Human Services, Mental Health, United Way, AARP, so, and Blue Cross Blue Shield, like I mentioned before. But this is definitely not a comprehensive list. It's just highlighting some of the partners that we definitely work with. And the last slide that I have for you is my contact information. So you can call me at 803-312-1354. And that's my email address, jwright@scthrive.org. So Paul, do I have any more questions?
Janise, looks like right now there are no other questions. Everything has already been covered.
Okay.
Anybody have anything?
There was a comment in the chat box. I'm not sure if you had an opportunity to see it, but it says schools may help with that as well. That was earlier, I believe, when you were speaking. And then it also says school social workers may help families with the BT application.
Mm-hmm.
And then it says to please reach out to school social workers, especially in high schools. They are very resourceful. Okay.
Right. So we do have schools that are our partners as well. And then I go around Charleston County, Dorchester, just the Lowcountry area. And I make sure that, you know, we take them marketing material, SNAP material, Medicaid material, because definitely that's a great way to definitely reach families. I agree.
All right. Does anybody have any questions? Anything that you can think of? Anybody?
No, I thought it was very thorough, as I stated before.
Absolutely.
And we certainly appreciate you taking your time, Ms. Wright, to share this information that is so much needed throughout our communities. So we appreciate you coming
And
on.
I appreciate all that you do as well. And again, I thank you so much.
All right, let's see. Give me a second here, guys. I'll get that video going. Okay. All right. Thank you so much, Janise, for taking time out of your day to give us all that great information. Wait, let's see. Oh, do I see a question? I see a question. Hang on.
I see.
All right, let's see. I've got Linda Lucas saying I was a benefits bank counselor as a school counselor a number of years ago as a retired person. Can I encourage a community organization to become a partner and get going with a program?
Thank you. Because we, SC Thrive used to be with the Benefit Bank, and then the Benefit Bank transitioned, and then we moved to ThriveHub. So if you have Benefit Bank experience, please reach out to me.
Absolutely. Absolutely. Let's see. All right, if there's no other questions, of course, we've got on the screen there, folks, you can see Increasing Hope's contact information. There's our phone number. Janice's email address, I know she's already said it, it's right there. If you want information on Increasing Hope's programs, you can email ebj@increasinghope.org. We do have a webinar coming up on September 16th in just 2 weeks. How to avoid financial pitfalls in your business. So get excited. You're on your way to secure your future. So our I Hope Women's Business Center will be doing that presentation on the 16th between 1 and 2 p.m. All right, if nobody else has anything, I'm going to give you guys back. Let's see, I think we're giving everybody back about 14 minutes of their day.
All right.
So again, thank you so much for all of those folks who took time to attend. Hope you got something out of it. And for those folks who are going to be watching this video in the aftermath of, hey, get some great information out of it. You know where to contact us. You know how to contact Janise if you need to avail yourself of those resources. So folks, have yourself a great afternoon. We'll see you next time.
Thanks, everyone.